Hello, my name is Jisugu. In this video, I will present our study titled Evaluating the Accuracy and Diagnostic Reasoning of Multimodal Large Language Models in Interpreting Neuroradiology Cases from Radiographics. Over the past few years, large language models have rapidly advanced and demonstrate strong performance not only in general language tasks but also in medical applications. In radiology, models such as GPT-4 have shown promising diagnostic accuracy and the ability to generate structured radiology reports. More recently, multimodal LLMs with vision capabilities such as GPT-4 Vision have been introduced. These models can process both text and radiologic images, raising expectation that they may support radiology workflows, clinical decision-making, and second opinion consultation. However, the actual ability to LLMs to interpret radiology images remains unclear. Multiple studies have shown that diagnostic accuracy is constantly higher when LLMs rely on text-based information rather than image inputs. In addition, multimodal inputs have not demonstrated a clear advantage over text alone. Importantly, only a small number of studies have examined how these models actually interpret images, raising concerns about whether LLMs can replicate the nuanced reasoning of human radiologists. Therefore, the purpose of this study was to evaluate the diagnostic accuracy and interpretative ability of multimodal LLMs in neuroradiology. To minimize the risk of training data contamination, we created radiology quizzes derived from RadioGraphics, a highly respected educational journal in radiology. Using these quizzes, we assessed both diagnostic accuracy and diagnostic reasoning and compared LLM performance with that of your radiologist. Here is the method. Radiology quizzes were created from review articles published in Radiographics between 2020 and 2024. After screening 55 neuroradiology-related articles and applying predefined exclusion criteria, 34 articles were included. From these articles, we generated 401 radiology quizzes covering brain, spine, and head and neck imaging. The quizzes included a total of 821 images, with MRI being the most common modality. To evaluate the effect of textual information, clinical history was intentionally omitted in approximately one-third of cases after removing imaging findings and diagnosis from the original figure legend. 5 multimodal large language models with vision capabilities were evaluated, including GPT-4 Vision and GPT-4 Omni from OpenAI, Gemini Plus from Google DeepMind, and Claude 3 and 3.5 from Anthropic. Each model was prompted using a single integrated prompt that requested the top 3 differential diagnoses. To assess image understanding, the model with the highest top 3 accuracy was further evaluated for its ability to recognize examination characteristics including modality, sequence, imaging plane, contrast use, and body part, and to describe region location and relevant imaging findings. To compare diagnostic performance, 2 neuroradiologists independently reviewed the same images and clinical information provided to the LLMs and generate 3 differential diagnoses per case. Diagnostic performance were evaluated using both top 1 and top 3 accuracy. In addition, the LLM-generated interpretation were evaluated for region localization and imaging findings using 4-point scales as summarized in the following table. Based on these scores, a precise interpretation was defined as a correct region localization with correct or partially correct imaging findings. We also assessed the presence of hallucination unrelated to imaging interpretation. Finally, responses showing precise interpretation without hallucination were classified as a stable result. Diagnostic accuracy of the 5 LLMs and 2 human readers was compared using generalized estimating equation to account for repeated measurement within the same cases. Performance was evaluated for the entire dataset as well as for predefined subgroups based on the presence or absence of clinical history. Here is the result. We first evaluate the diagnostic accuracy of LLMs and human readers. Overall, the diagnostic performance of LLMs was limited. Even the best performing model achieved a top 3 accuracy below 50%. In contrast, both neuroradiologists significantly outperformed all LLMs. When considering only the first-ranked diagnosis, the diagnostic accuracy of all LLMs further decreased, and both human readers continued to show significantly higher top-mode accuracy compared with all LLMs. Importantly, when clinical history was provided, the diagnostic accuracy substantially improved, whereas performance markedly declined in cases without any textual information. These findings indicating that LLM diagnostic accuracy is largely dependent on textual information rather than image-based interpretation. The rationale for the differential diagnosis was assessed using GPT-4 vision at temperature 1, which achieved the highest top 3 accuracy. In this matrix, yellow squares indicate precise interpretation, and red squares indicate inaccurate interpretation. GPT-4 vision at temperature 1 showed precise interpretation in 30.7% of the cases. In contrast, inaccurate interpretation was observed in 35.9%. Hallucination were observed in 18 cases, of which 14 cases were related to disease knowledge and 4 cases were associated with radiologic knowledge. The acceptability of the LLM genetic analysis, defined as cases with precise interpretation without hallucination, was 29.4%. When we analyzed the interpretation quality using matrix-based evaluation, clear differences emerged depending on diagnostic correctness. Among cases with correct diagnosis, precise interpretation was observed in about half of the cases, while inaccurate interpretation was relatively uncommon. In contrast, for cases with incorrect diagnosis, the rate of precise interpretation dropped markedly, and inaccurate interpretation became the dominant pattern. The matrix in cases using text inputs with clinical history showed a precise interpretation of 38.6%. However, region location and imaging findings were not described in 31% and 9% of the cases respectively. In cases without textual clinical history, 58.1% showed inaccurate interpretation. This observation suggests that LLM tend to over-rely on textual input rather than performing a detailed analysis of the images themselves. The accuracy of the imaging finding was also assessed using the GPT-4 vision at temperature 1. The model demonstrated very high accuracy in identifying imaging modality and scanned body part. In contrast, performance was significantly lower when determining the use of contrast material. These findings indicate that while GPT-4 vision reliably recognizes general imaging attributes, it has limitations in identifying more nuanced acquisition details. In conclusion, current multimodal LLMs markedly underperformed compared with neuroradiologists and frequently demonstrate unsatisfactory reasoning for their differential diagnosis. Overall, their diagnostic performance relied heavily on textual information rather than true image-based interpretation. These findings highlight the current limitation of multimodal LLMs in neuroradiology and emphasize the need for more rigorous evaluation. Thank you for your attention.